Hello, my name is Sheree Shelton. I am doing my MedPass checkoff. So, the first thing that I will want to do is I will want to wash my hands. Well, I will gather the mark, and I will want to um, wash my hands and gather the medications for the patient, checking them against the MAR. So, here we have acetaminophen. It is 500 milligrams per tablet. Says on the MAR for the morning dose to give 1 dose of acetaminophen of a 500 milligram tablet. And then right here I have a liquid. It is Benadryl, and it says to give 2 milliliters by mouth every 4 hours as needed. So I would gather this medicine, the acetaminophen. I would use a medication cup, and I would just pour 1 tablet in there. And for the Benadryl, I would pour this in the medication cup at the 2 millimeter mark, and I would get down to eye level on the counter, and I will pour it and watch it go to the 2 milliliter mark, and then I will stop, close it up. As I'm opening the Benadryl and setting the cap down, I will always set the cap face up, never down onto the counter. And then I will check it one more time, the MAR. All right. And then I will come into the patient's room, knock. I will introduce myself. Hello, my name is Sheree. I will be giving you your morning medicine for today. How are you doing? And then I would ask the patient for 2 identifiers, which right now is Minnie Mouse, because my baby is not cooperating with me to help me with my assessment. So, can I get your name and your year of birth? Minnie Mouse, 1929. Thank you. Okay. So then I would take her vital signs just to have a reference, just to have a baseline, because this is the morning medicine. So I would take her vital signs, and then I would, after that, I would prepare to give her medicine again. So I will wash my hands again, and then I would give her her cup that has the 1 tablet in there according to her MAR. And then I will watch her take it, make sure that she swallowed it and not hoarding it in her mouth or hiding it under her tongue. Shh. Or hiding it under her tongue. And then I will give her the cup full of the liquid of the 2 milliliters. And then I can just watch her take it and make sure that she swallows it. The acetaminophen is for pain reliever, fever reducer, and the Benadryl is sometimes for allergic reaction. Also, I'm sorry, but I would ask the person, or I would check against their MAR also about their allergies to any medicine. And then she has no known allergies, so that gave me the go-ahead to give her meds. But if there was somebody that was allergic to penicillin or could not have any type of medication, I will make sure to not give them that medication. Okay, after her medication has been administered, I would just let her know, if she didn't know already, that the acetaminophen is for a fever or any headaches or a pain reliever, and the Benadryl is for allergic reactions or anything that may be going on that is making her react to something in her body. After that, I would, so with the medication administration, I'm making sure to give to the right patient, the right dose, the right route, the right time, right patient, dose, route, time, and right medication. So those things were all assessed as I was checking over her MAR and as I was identifying herself or who she was, and as I was looking over the medicines, because obviously this is a by mouth and also the liquid is a by mouth. So that was checking the right dose route, and like I said, this was a morning medicine, so it was the right time to give it to her. After that, I would ask if the patient needed anything, and she says no. So I would just make sure they're in a comfortable position, and I would give her the call light and tell her to call me if there's any problems. Right now, I probably would not do a pain assessment because I would do a pain assessment, I'm sorry, because I want to have a baseline to compare with. So I would assess her pain. So she says it's a 5 out of 10. And by giving her the acetaminophen, then I would come back later, probably in 20 or 30 minutes, and I would assess her pain again, and I would expect for it to be lower. And if it wasn't, then I would check her vital signs and like her temperature and see what the RN would like for me to do from there, or let the RN know so that she can do something from there. And that is my med pass, and I would take my MAR. I wouldn't bring the whole bottle of medications in, I would just bring their dose. But I would take all of my belongings with me, and I would close the door or ask them do they want the door closed or their curtain pulled for privacy, and that will complete my medication assessment. Thank you.